It's all in your head. You don't look sick. Your tests are normal. It's probably anxiety. There's nothing wrong with you. Have you heard these words from physicians, family, and friends? If you're someone who has been swirling through the revolving door of healthcare to find answers about your health, or if you know someone who is going through this experience, then this podcast is for you. Hello, everyone, and welcome to the Desperate for a Diagnosis podcast. I'm your host, Laura Nozicka. I am so pleased to be here today with Alina Gur. And the reason I'm so happy to have her is because, for one, our topic today is very important for women of all ages. And it's also very personal for me because Alina is a pelvic floor physical therapist, and it really is a sensitive topic. But because May is Pelvic Health Awareness Month, I really wanted to bring this topic to light. I want women, and there are some men that go through this type of physical therapy. I want everyone to understand that this shouldn't be a therapy that you should be embarrassed about or feel apprehensive about, even though it is very sensitive and it's very personal. It's so helpful, everyone. And I just want you to hear it direct from this amazing and passionate physical therapist who's been doing this for quite a while, and I'm excited to introduce her. So let me tell you a little bit about Alina, and she is just going to shower us with so much knowledge and wisdom and her expertise. So thanks for being here, Alina.
Absolutely. Thank you so much for having me. I'm very excited.
I love it. We talked so much in our pre-chat about so many things, and I thought, oh my gosh, I should just be hitting record right now because we talked about so many different topics, but we will dive into all of that today. But a little bit about Alina. Alina has been treating as an orthopedic and pelvic health physical therapist for over 5 years. She received her Doctor of Physical Therapy degree from the University of Wisconsin-La Crosse and her pelvic health training from the Herman and Wallace Pelvic Rehabilitation Institute. Now, let me just stop for a second, everybody. Understand that physical therapists are PhDs. They are doctors. They might not be what we know as medical doctors necessarily, but physical therapists do rigorous schooling to get to where their expertise is. So I want everyone to understand that, and I want to make that clear. In other words, Alina and her fellow physical therapists, they know what they're doing, and I wanted to make that clear. Her career began at the VA Palo Alto Hospital System in Monterey, California, where she cared for veterans of all genders, both face-to-face and virtually. Now she's traveling the country as a contract physical therapist. She has been serving communities with limited pelvic health resources, which we'll talk about, and mentoring newly certified pelvic practitioners. She also provides telehealth physical therapy services through Simple Therapy and helped to develop their pelvic health program content. So, Alina, I don't know, kind of a slacker. What's the deal?
Okay, yeah, definitely taking it easy. No, the travel life has been really enjoyable. We've been loving it, but I do love that I've been able to continue my pelvic health background and give back to the communities that I go to.
Well, it sounds like you are having quite the influence and impact on all of these communities where you are traveling to. And again, this is a really personal conversation for me as well, because I myself have gone through rounds and rounds and rounds of pelvic floor physical therapy for a variety of different reasons. I'm not afraid to share what those are, but we'll get into that in just a bit. And given that May is Pelvic Floor Health Month, Alina, tell me a little bit about, at a high level for now, why do we have to have healthy pelvises? Let's start there.
Oh, great question. Every body has a pelvic floor. So everyone can benefit from pelvic floor physical therapy, men, women, any other gender in between, and then even children. So there are some physical therapists that are specially trained to work with various populations, but generally, any person can benefit from at some point doing some pelvic floor physical therapy, especially those people who are having dysfunctions in either their bowel, their bladder, their pelvic girdle, so their hips, their SI joints, even the low back and abdominals. So, really, anything I like to joke from the neck to the knees
Mm.
is definitely a piece of physical therapy that we see in pelvic floor PT.
Mhm. Yes, and that whole tune, I don't know if you listened to this tune as a kid, but we know that whole this bone is connected to that bone. Yeah, it's the same thing with muscles and ligaments and tendons and all of that. Everything is all connected, and I don't think we always understand that's the case. And I think what's really cool about physical therapists, and there's a lot of things that are cool about PTs, but I think what's really cool about physical therapists is that all of you really do look at the whole body beyond just the one body part that the doctor wrote the script for. I think that you have such a huge understanding about how, well, maybe it is a neck thing or a lower back thing, but you did something to your neck higher up in your cervical spine or whatever it might be. But I think you really understand how the body works together and how something could be happening over on this side and it's affecting something else.
Absolutely.
Yeah.
It's a lot of conversations that I have with my patients is how even their jaw pain could be related to their pelvic floor or a history of an ankle break 10 years ago affecting their walking, affecting their pelvic floor. So there really are a lot of moving pieces.
hmm Yeah. So I think the educational part for patients is such a benefit because we know that our physicians don't always have the time to sit with us and to really explain how things work and why we might be in pain or having certain issues. And sometimes, let's face it, doctors don't always know themselves to be able to educate us. And that's why a lot of times physical therapists know so much more about certain things than the doctors even do. So you do fantastic work. So kudos to all the PTs out there.
Yeah, we appreciate it.
Yeah. Yeah. So talking through why we need a healthy pelvic floor and what that means, but I'd like to talk really in depth about pelvic floor therapy because, again, like I said in the introduction, pelvic floor therapy has come along. It's been around for a while and it has certainly evolved. I started my own journey with pelvic floor physical therapy back in, oh gosh, like 2007. And it was very new back then. I was lucky because I was actually working for a health system and I had access to physical therapists, and it was a pretty progressive department where they had already started doing pelvic floor PT for women. And I was having some issues that mimicked a UTI. I thought I had a UTI. And so I started going to urologists and I went through all of this really daunting urodynamics testing, which is not the most dignified of testing to go through. And so it was assumed that I had a urinary issue, a bladder problem. And it took 6 months and going to a different physician to say, no, I don't think you have a urinary issue. I think you have a pelvic floor issue and you should go to pelvic floor therapy. I had no knowledge of what that was or what it meant. So it really has evolved. And you mentioned access in your bio, and it's just really hard to find, even now, pelvic floor physical therapists. But Alina, why don't you give us some examples of why someone might need a pelvic floor PT and some of the conditions that pelvic floor PT might be helpful for?
Yeah. So I think first, just an understanding of what the pelvic floor is will really help bridge that conversation. So I love to bring up a little bit of anatomy. It's one of my favorite things to talk about. My patients always joke that I like to pull out the models and start pointing at things.
Yeah.
But I think knowledge is power. So the pelvic floor is really just the group of muscles that sit at the base of the pelvis. So if you can picture your pubic bone, so where your zipper of your pants are, your tailbone, and then your two bones that you sit on, your sits bones, if you are in yoga.
Okay.
The area between those structures, kind of a diamond, make up the pelvic floor, which is essentially this little hammock, if you will, of structures that help to support your bladder, your rectum, and females, your uterus, and in males, the prostate. So all of those structures supported by the pelvic floor, as well as the pelvic floor acting as a piece of your core. So anytime you do any movement, your core is a little active. So is the pelvic floor. So when we talk about what people are going to benefit from pelvic floor physical therapy, anything that involves urinary or fecal concerns. So maybe some leaking, maybe some difficulty holding the liquid or the stool in, bladder or bowel pain syndromes, pelvic girdle pain. So again, your SI joints, the pubic symphysis, so that section right between where the hips meet in the front of the body, again, that zipper area. Pregnancy and postpartum, pelvic and perineal pain syndromes, which it sounds like you would kind of fit into those categories. Sexual dysfunction, abdominal or pelvic surgeries, any breast cancer or prostate cancer, and then the surgeries or treatments that follow those types of patients. I mentioned pediatrics, which is very niche. And then the newer and more upcoming section is on gender affirmation.
So it's so varied in terms of the conditions that you can treat, but everyone's different. And so it must be quite satisfying for you as a PT, and every day must be interesting.
Every day's a roller coaster.
Well, thank you for that. That helps really understand some of the anatomy of the pelvic floor and what some issues might be brought about if you don't have a healthy pelvic floor. I know, like, at one time I was seeing a PT, more of a, I guess, a general PT, I would say, for a SI joint that was out of whack. But it made me feel like, it made me wonder, do I have an ovary problem? Is it my colon? Is something happening? And I mean, just something like simple, like an SI joint. And I think too, from a kind of overall physical therapy standpoint, that people who are sadly walking around with back pain, especially back pain, is so prevalent, and it's just one of those mysteries as to why back pain can't be fixed. But it could be something so simple, and people are walking around in pain and popping pills and whatever. And that's why I feel so strongly about people exploring the idea of pelvic floor therapy, because it is a commitment. I will say that. It can be invasive if it needs to, and if your patient wants it to be. There's ways to get around that, as you said, as we talked about before. But tell me a little bit about some of the misconceptions of pelvic floor. Tell us what it is, and tell us what some of the misconceptions are.
So, for the most common misconceptions I hear is that it's for people who recently gave birth. And while that's not okay, sorry.
Okay. Take your time, take a breath.
Okay, could you pose the question again?
Yeah. So, my question is, what is pelvic floor therapy? Kind of high level. And what are some of the misconceptions?
So, I think one of the biggest misconceptions that I hear from patients is that it's just for people who have recently given birth. And while that is a pretty large chunk of the people that I'm treating are pregnancy and postpartum, it's not just that. I can see people for constipation. I can see people for, bladder dysfunction, and they don't have to have ever had a baby or had a pregnancy. And then, like I'd mentioned, some of those other situations before, but um, I think another thing to think about too is that there's this conception that you have to do internal work to be a good pelvic floor PT or a good pelvic floor patient. And that's not always the case. Internal work is really beneficial for those people that do need it. But I'll have to admit that maybe something like 50% of my patients never get internal assessment or treatment with me. And sometimes that just depends on their personal background, my assessments externally being enough to kind of drive my thinking, or just they weren't really comfortable with it. And so we avoided it. And that's totally okay too. So, definitely something to think about if you're shying away from pelvic floor physical therapy because you don't want to go through that. There are ways to work around it. So I'm glad you had mentioned that earlier as well.
Yeah. Yeah,
Mhm.
because talk a little bit about what the pelvic floor PT would do from an external standpoint and then internally, and how both would benefit a patient.
Yeah. So I think there's a lot, and it just depends on the physical therapist that you're seeing. There's a lot of PTs who have been trained that you need to do an internal exam to have good, solid, gold standard information about how that person's pelvic floor is functioning. And I'd argue that that's not necessarily true. Um, I've found that assessing their hip range of motion, their abdominal strength, their breathing has been one of my biggest things that I address with all of my patients because I've found a lot of funky breathers out there.
I get that though, because I, for years, just was, they always say walk around, and if you're walking around, you want to like zip up your abs and all of that. So I'm walking around with my guts sucked in because was what we do sometimes. And I got very used to doing that. And the several times that I went through PT, the PTs would say, What have you been doing? Have you been
Yeah.
hyperventilating your whole life? Like, why don't your abdominal muscles relax? Because they wouldn't. And of course, again, that's all connected to pelvic floor.
Yeah.
Um, and so yeah, like that alone, like your breathe, your diaphragm, all of that.
Yeah.
Yeah.
The deep abdominal muscles and the diaphragm and the pelvic floor are so intricately connected that if you are holding in your gut or sucking in your stomach throughout the day, you're kind of doing a Kegel all day. You aren't really allowing your muscles to relax at any point. And we know from a muscular standpoint, healthy muscles can both contract and fully relax. And that I think is another common misconception in pelvic PT is that it's all about the Kegels. And I'd argue that I I think we need to do a lot more breathing, a lot more breathing.
Yeah. Yeah. Um, and a lot of times during a pelvic floor session, uh, because it can be very personal, and the reasons why a patient might be getting pelvic floor, like you said, things like cancer treatment, potentially radiation can cause scar tissue for men as well, or sexual dysfunction is an issue. So it can get a little emotional. And you were talking about trauma informed care and making sure that physical therapists are sensitive to that. How does that fall in line with the overall therapy approach?
Mhm. I do think that most practitioners practicing pelvic floor physical therapy have a special sensitivity to trauma informed care because our subject matter is so personal. But I do find that in most instances, giving patients the most autonomy that you can and telling them, look, everything's in your court. these are the things that I can provide you with. These are the services, these are the manual therapies, these are the assessments that I'm thinking of. But what are you comfortable with? And just taking time to meet the patient where they're at and just letting them know that you're not there to force them into anything that's going to feel uncomfortable. You're really just there to help and support them as much as possible. So leaving space for that. And then in many instances, even offering them, look, like some of the things that come up for us in therapy might bring up some emotional background. Do you have someone to process this with at home? Do you have access to a mental health counselor? Do you have someone who can help you process the things that we're going through in a mental, cognitive, behavioral standpoint? Because I'm a physical therapist. I can only do so much cognitive behavioral stuff
Mhm.
before it's a little outside of my wheelhouse. And so I hold space for patients, but I also tell them you have resources if you need them.
So if we were to break it down a little bit in terms of a little bit more in terms of the types of situations where pelvic floor therapy would come into play. So you said one of the misconceptions is that it's for mostly for women who have given birth. But let's talk about that. What would be kind of like the chief complaint or main issue that a woman who has given birth would have that would warrant or trigger a recommendation for pelvic floor therapy?
I've actually had the pleasure of working with some OBGYNs and various different providers in the area who are very open to providing pregnant and postpartum women a referral the second they ask for it. And I think a lot more women are advocating for themselves too. But really, I'd argue any person who is pregnant, preparing for delivery, or has experienced C-section or vaginal delivery could benefit from at least an evaluation from pelvic floor physical therapy to assess the many different physiological changes that happen when a person carries a fetus. So, I mean, there's postural changes. The stomach muscles can get separated. A lot of information about diastasis recti now. We can assess that. We can help them to just find their core again after those muscles have been engorged and stretched out for so long. Obviously, bladder bowel dysfunction can happen. And then I've even seen like nerve pain conditions from vaginal lacerations from delivering the baby and seeing them get back into their normal habits and normal routines and even getting back to a normal sex life has been really, really important to help them with. So I would argue any person during pregnancy would benefit.
Yeah, 100%. How about from the standpoint of fertility? Does pelvic floor PT help with getting pregnant at all?
Oh, that's really interesting. I actually haven't seen too much about that myself. I know Herman and Wallace has had some courses about like visceral mobility, but I've really only browsed their content. I haven't taken those courses. I'm sure someone with more training in that might be able to speak up and give you some information, but I'm not certain in terms of fertility. Um, I do know that IVF can be a lot on the body. So, any other pain conditions that come up from those changing hormones and stuff could be useful to see a PT.
Well, yeah, so I don't have children and never tried to have children, but I'm going to toss out an assumption. If if a couple or woman is really wanting to have a baby, wanting to conceive, understanding that it's such a stressful thing that those muscles. So I had the opposite problem where I just had really tight pelvic floor muscles, and if that's kind of the stress spot, maybe sexual activity really isn't what she's interested in because it's painful, whatever. Um, and so, maybe that's something that would be helpful for a woman who's looking to conceive, and it's just so stressful.
Yeah, I have actually treated some patients whose goals were to tolerate vaginal penetration so they could get to having a pregnancy and things like that. And that's where learning to like hold that space for the patients and see what are your actual goals and how can I get you there can be super important.
And so what are some of the other scenarios where patients would find PT valuable from the standpoint of like um prolapse, some type of prolapse or something like that? Because you talked a little bit about incontinence from a standpoint, either from a urinary standpoint or from a gastric rectal standpoint. What's helpful there? How would someone benefit?
Yeah, so specific to prolapse, prolapse generally happens when there's poor abdominal, intra-abdominal pressure management. So, in different words, basically your ability to control your core without putting too much pressure in one direction. So, if you are having really difficult bowel movements, so constipation, straining, if you're lifting heavy and not using good breathing mechanics and putting too much force down through your pelvis or out through your stomach, I always like to talk about the soda pop can model. Have you heard of that?
No, haven't heard of
Okay.
that one.
The soda pop can model is kind of like we picture the abdominal walls as the walls of the soda pop can. So
Okay.
the abdominal muscles, the back muscles, your pelvic floor is the bottom and your diaphragm is the top. So it's a closed pressure system, right? So if we want to maintain pressure in the system, everything kind of has to move as a unit. So that's where that diaphragmatic breathing comes in. Diaphragm expands, has to relax, pelvic floor relaxes, everything contracts when we exhale. It's kind of like that piston movement. If you are putting too much pressure on the walls and we're gripping our abdominals when we're trying to do something, the weakest link, that little pop can, is where all that pressure is going to go.
Mm.
And in some cases, that's the pelvic floor. In some cases, that's the abdominal wall. And we see that separation and that big dome that happens when people are getting out of bed. You've seen that probably.
I get that, and that's a great way to explain it. Um, and for for men, I know it's a small percentage of men who will have pelvic floor PT, but what are some of the scenarios that men would be having PT, and how does it help them?
Yeah, so for male bodies, the anatomy is essentially the same with the exception of the external pieces.
Mhm.
Um, but when we're talking about the muscles, similar things can happen. We can either have muscles that are too tense and holding too much tension, which is going to limit things like the ability to have an erection because there's no good blood flow coming to the area, or pain with erections, pain with ejaculation, things like that. Or the muscles can be very weak, and then we can have problems with controlling urine, and being able to control their gas, things like that. There's also obviously post-prostatectomies, so prostate cancer being one of the most common cancers to affect um, males who are coming into my clinic, often coming from urology and not sure why they're there. But to teach them how to find those muscles, how to use them, and how to strengthen them after the procedure, because the prostate is actually a support structure for the bladder and the urethra. When we take that out, now the muscles have to do it all by themselves. So they really have to get trained up to provide that support.
Mm.
So a lot of different scenarios could bring a male into the clinic. I've had males with pelvic pain, erectile dysfunction, all of it.
Yeah. And I understand too, even because of radiation, potentially scar tissue buildup
Yeah.
also. Is that a possibility also?
Yeah, absolutely. I mean, I'll admit I haven't seen a lot of patients who have had the radiation specifically. I see a lot more of the prostatectomies or the RARP procedures, but I haven't personally had to do dilation with those patients. I do know some other physical therapists I've worked with where doing dilation to those structures can help them to get that scar tissue to break down.
Mhm. Yeah. Yeah. So I was telling you, like for me, I have endometriosis and have had 3 surgeries, and so just from the scar tissue from the surgeries alone, let alone the adhesions from the endometriosis, I'm like this potpourri of all kinds of stuff going on in the pelvic bowl there. Yeah. With scar tissue and lesions and adhesions and all of that. So it has been so helpful for me for sure. But you mentioned dilation. And if you could, Alina, talk about some of the modalities that you might use during a PT session and what do they do? What problem would they solve?
Yeah, so I think modalities most depend on what symptoms are presenting in front of me. So dilators are usually more common for the patients whose pelvic floor is so tight and so tense that they're having a hard time tolerating penetration, vaginal exams, things like that. Um, and the dilators are just a graduated way for us to slowly stretch out those structures so that they can tolerate those things with less pain. That's something that I actually prefer patients to purchase themselves, unless their insurance will cover it, and then do that in the comfort of their own home. Like, I give them all the tools, but then being able to do it in a very relaxing space and with privacy and feeling totally safe is, I think, the most important piece of that. I've had some patients bring their dilators into clinic sessions and I help them with it or I show them techniques, but it's most effective if they're doing it themselves. So, in some ways, they kind of have to be comfortable with doing that and with approaching their body with an open mind and feeling ready to use those tools. But there's some other really fun modalities that I can talk about too. So, one of my favorites is using biofeedback. Are you familiar with biofeedback? You use the
I'm not.
Prometheus unit.
I did way back when, yeah, in terms
Yeah.
of muscle contraction and how long it would take to relax the muscle. So yes, that was quite a while ago. And like you said, not all clinics have it, but I was lucky that mine did initially.
Yeah, they used to have these huge machines and it looked very much like a computer, right? And then you were attached to an electrode and then you would do the squeezing and there'd be a little picture on the screen moving. Was that what you were doing?
Uh-huh.
Yeah.
Yeah.
Um, they're very expensive units, so not everyone has access to them. I've only had a chance to play with a couple. But biofeedback itself is just the use of another sense, another physical sense to create understanding of a muscle contraction or of an action. So I'm very low tech and I take a towel, like a hand towel, and roll it up and have someone sit on it. And that
Mm.
pressure of their perineum or their muscles on top of that towel roll gives them a lot of really good information about when they're squeezing, they're lifting their muscles away, and they can feel that a little bit better.
Mhm.
They relax, their muscles go back into the towel roll. So the running joke at our clinic is I'm always running us out of towels. It's always my fault that we're out of towels. It is really useful, and patients do find it really beneficial to like feel those muscles because you can't see them like you can see a bicep, you know? Um, and then there's also dry needling. I was certified with dry needling through Herman and Wallace, specific to the pelvic floor muscles. And that is an external technique using acupuncture needles, but not acupuncture technique. And they are aiming at the internal structures. So for some of my patients who don't want to do any internal, but they're open to the idea of at least allowing me to aim for those structures, getting them in the positions to insert the needle and to apply a little bit of electrical stimulation can get that muscle twitch, can bring in that fresh blood flow, and help so much with pain conditions. And in some of my patients, they can actually tolerate using their dilators better once we've gotten those muscles to relax with the needling.
Yeah. 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 I think that's so cool that again, it has progressed so much in the last several years. And then are you using things like ultrasound as well?
I don't use ultrasound as often because, again, it's hard to get your hands on a good, high quality unit and visualize what we're looking for. The VA that I worked for had a beautiful unit, and then I was doing a lot of ultrasound, real time ultrasound, showing people here's your bladder, here's your pelvic floor muscles. The VA that I worked for had a beautiful unit where you could really see all the structures. And then I was using a lot of ultrasound, real-time ultrasound, where I was showing the patient, here's your bladder, here's your pelvic floor, do a Kegel contraction, and you can see the bladder actually moving and displacing in their abdomen, which was very useful for if they're doing their contractions right. Um, More recently, I've actually been using electrical stimulation or a TENS unit.
Mhm.
Have you heard of the transcutaneous tibial nerve stimulation? Did you have any like bladder urgency problems?
I did for a while just because, I mean, everything was just so my muscles were just they're just a mess, like, just a total mess, and I drink a lot of water to begin with, and I had to do a lot of bladder retraining to because I was using that muscle, the bladder being a muscle, I was overusing it because I was constantly going to the bathroom, but I had to retrain my bladder though too. Like I said, I didn't quite have a bladder issue necessarily, but because the muscles were so tight and just dysfunctional that it caused a lot of dysfunction on my bladder too. So I would have to retrain my bladder. That was something else I was doing where like if I felt I needed to go, the doctor would say, try to wait, try to wait another 5 minutes, 10 minutes, whatever. And just because like your brain thinks you need to go, you don't maybe necessarily really need to. It's just a habit, but it's just because the muscles were just so messed up.
Um,
Yeah.
yeah, so a little bit of that behavior modification and yeah. So transcutaneous tibial nerve stimulation, you can use a TENS unit. And I've actually had patients buy their own unit on Amazon. It's like $30,
Mhm.
$35.
They are
And
helpful. They are
they're
helpful.
super great.
Yeah.
Yeah. You can put those 2 little pads right behind the ankle. The same nerves that go to your bladder go down to your ankle.
Oh, I see. I didn't know that. Mhm.
Yeah, so we can kinda stimulate those nerves, and I've seen a miraculous, actually, improvement in some of my patients' urgency. I actually had an 82-year-old man who was scheduled to get a spinal stimulator placed,
Oh.
and he was like, "I really don't want a surgery." He came in to see me. We did some like learning and stretching exercises for awareness, and then the posterior or the transcutaneous tibial nerve stimulation. And within 5 visits, he canceled his surgery, and he's like, "My bladder's fine. We're good."
Oh my gosh.
Yeah,
See, that's what I'm saying. Like you just like there's a reason I think doctors will sooner refer a patient to PT before, certainly being more conservative and or insurance isn't going to say, "Oh, sure, go right to surgery." But they'll start you in a kind of stepwise program to start with PT because you just never know what that true trigger is. But I think that's amazing. So the TENS unit goes at where on the ankles? Is the outside
yeah.
ankle?
So 2 little electrodes right on the back inside of your ankle. So I could pull my leg up here and show you if you want.
Okay. Let's see those pretty legs. Let's see them. There you
Okay.
go. On the inside. Okay. Got it. Yep. 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 Okay.
Um,
Understood.
but what was really fun too was that patient had asked his provider, "I wanna see pelvic floor PT, I've been Googling about it." And the provider was like, "I don't know if that's gonna do anything for you, but good luck."
Mhm.
And then
Mhm.
he ended up canceling his surgery, so I really hope I will see more patients whose doctors are willing to send them to us first, eventually.
Yeah. Well, good for him at 82 that he's just Googling the options
Yeah.
and I'm sure he was fully aware too, probably, I'm guessing, for this patient, but to have gone through some type of bladder surgery could mean a long recovery, could make other things worse, could cause other problems, and so good for him that he advocated for himself and investigated a solution that was more conservative and it worked for him. So that's fantastic. That's really cool. Yeah, I didn't know about the ankle thing that are the same nerves that go to your bladder. That's fascinating.
And it's so inexpensive, and patients can do it themselves every night for a couple, well, 12 weeks, but still, like, worth it. Worth
Yeah.
it.
Yeah, for sure. Oh, that's so cool. Those are good stories when I hear again patients advocated for themselves and they found something completely non-invasive that solved their problem, which is why again, I think physical therapists just the science, but there's this magic behind it too, I think, with PTs. So I think that's awesome. Um, I know that it can be very hard to get into one, to find a good pelvic floor PT, and one to actually get into one. Access is really problematic. Tell us a little bit about why that's the case.
I think access in healthcare right now is just a hot topic in general. There's just not enough providers for the patients who need help. Um, but I know specific to pelvic floor physical therapy, it's niche. Like there's we go to PT school and we assume we're going to work with athletes. At least most of us do.
Mhm.
And then we start going off our separate ways. And I think there's a select few people who feel comfortable talking to people about pooping, peeing, and sex all day. Um, yeah, sometimes they can be heavy topics, and
Yeah,
sometimes you have to have the right, I'd say you almost have to have the right personality to make people feel comfortable
for
talking.
sure. You're building a rapport with someone that you'll be seeing. Um, yeah, how long is pelvic floor therapy usually?
The time to receive treatment,
Mhm.
I think that's very much dependent on the patient's severity of their symptoms.
Okay.
So I've had some patients who come in even just for one visit and just get an assessment, get some ideas. Their symptoms are pretty minimal. They're feeling like they've exercised in the past, so they kind of know what to do if I point them in the right direction. There's other patients who, they've got multiple joint areas of pain. They also have pelvic pain and bladder dysfunction and bowel dysfunction. And then the more complicating factors pile into that person's complexity, the longer it's going to take us to crack and chip away at each of those little pieces.
Mhm.
Um, so it is really person dependent. And I think that's a good conversation to have with your provider when you first see them is, with how I'm presenting today, what would you think or how long do you think it's going to take us for me to see relief? I will caution people though to take sometimes a little bit of a grain of salt with that. I've had some patients that come to me and they're like, "Oh, my last PT said they could fix my pelvic pain in 6 visits." And I was like, 6 visits is pretty quick for what we've got going on here.
Yeah.
So,
Yeah.
being ready to have those conversations and ask those questions, but recognizing that, everyone's timeline of healing is different and it's okay for things to be a little bit of a roller coaster as long as the trajectory is always some improvement.
Mhm. Yeah, because people who are complicated, um, boy, I would have loved for 6 visits to be cured, my gosh, and I went through several rounds of PT over the years, again, starting from 2008 and, going into, probably I think I probably stopped even maybe, like, 5-ish years ago, and then menopause came rushing along, and it brought on all kinds of other problems that it's like pelvic floor, whatever. I have to worry about my hot flashes
Yeah.
and sleepless nights. But yeah, those are all issues that can be so life-changing from the standpoint of your quality of life, where you feel like you can't do things, or you're in pain all the time and doubled over, or on the flip side of that, it's I gotta know where the bathroom is if it's a bladder problem or anything like that. So it certainly is life-changing when you find the right PT, and the first one might not always be the right one. So how would you suggest patients kind of vet out their physical therapist, especially with the first visit, because you don't really know what you're supposed to know and you might not always know all the questions that you should ask. So what might you suggest?
Yeah, so that first appointment, it's not just an assessment of you. You can also be assessing your provider. If you feel like, you want to ask them questions about their background, that can give you a lot of information about their experience. So, training in pelvic floor physical therapy, there's a wide spectrum. Generally, you can start treating pelvic floor patients as soon as you've had your level 1 certification, which usually, I think in both Herman and Wallace and the APTA, covers females with bladder conditions and maybe a little bit of prolapse. So that's just a little piece of all of the things that we can treat. But once people are seeing more patients, they're usually like more interested in how do I treat this now that I've seen some of this. And so continuing their education or at least understanding how they've continued their education through time and what their experience is with the different conditions or the condition that you're coming in with can be really useful for you to suss out, does this person have the qualifications to be helping me? Most physical therapists, or at least I argue the good ones, will know how to set some boundaries. I know, and say, I haven't seen a lot of this, so I'm going to pass this off to my colleague. Or they'll get the referral and say, I'm just not comfortable seeing that yet. And then that is another reason why access can be challenging. Um, I know when I first started as a pelvic floor PT, because I just had my level 1 for a little while there, I did not wanna see any bowel concerns or bowel issues because I just didn't know what that all was. I was still figuring out the bladder. So, I think if they've taken you into their clinic at the time of the appointment, you can assume they've got at least some background to have seen your diagnosis. But asking those questions like, "Have you seen other patients with my condition?" Or, "In your experience, what do we do for things like this?" Or, "What courses have you taken to qualify you for treating me for this condition?" Those can be good questions just to understand where they're coming from.
Yeah. And kind of on the flip side, if a patient feels that they could benefit from pelvic floor therapy, is there, for what you know of physicians, is there a resistance at all with physicians for referring patients for PT? And if that's the case, how would you suggest a patient advocate for themselves to bring up that conversation with their doctors?
Yeah, I feel like that's been getting better. I'm seeing a lot more referrals, seeing patients a lot sooner with maybe less severe symptoms, and their PT's going, or their doctor's just going, "Oh, you should see PT for that." Um, I feel like when I first started, even about 5 years ago, there was a lot more resistance. I had to convince doctors that I knew how to help their patients and that they didn't have to go straight for medications or surgeries. And so I did have a lot of meetings face to face to explain what my background was and how I can help their patients. But if you are looking to get maybe some treatment for pelvic floor dysfunction, having some, I'd like to call it data, or having some background to show your doctor and say, look, this is what I'm experiencing, and this is why I think pelvic floor PT could be useful for me. There is a screening tool called the Cozine screening tool, and I can provide you and your listeners with that link to that. But it's just a quick questionnaire that you circle answers yes or no if you're experiencing certain symptoms. And in the research, we've seen a really high correlation between people who have circled at least 3 or more of those questionnaire items and actually having true pelvic floor dysfunction. So it's actually a very good tool. Very quick, print it off, do some circles, and take it into your doctor and say, look, I think I should see a pelvic PT. They're definitely going to be a lot less resistant when you come in with information like that.
Yeah. Yeah. No, that's a great tool to guide the conversation with a physician because sometimes I'm sure physicians don't always know all the potential symptoms that pelvic floor therapy can treat for them to even think, oh, well, instead of me putting you on, I'm making this up, instead of putting you on birth control or whatnot for your pain, your period pain, maybe whatever it might be, why don't we try pelvic floor therapy first or putting you on pain pills? Oh my gosh, I can't even tell you the prescriptions that I was given for muscle relaxers and gabapentin. In fact, there was even a clinical trial that started at one of the local university hospitals for pelvic floor therapy, and they were using gabapentin as one of the treatment modalities. And after, it didn't take more than a couple weeks for me to just say, I'm dropping out. I don't like the way I feel on this medication. I will move on to something else or live with it. Unfortunately, there's so many people, women in particular, who get the just live with it conversation. I won't live with it until I know I have to live with it. If I know that there's nothing else left. But yeah, before you're being put on scheduled drugs, for doctors to understand, let's give this a try first. And unfortunately, it's getting their ear. That's always the challenge.
And what side effects are there from physical therapy versus a medication, right? Most, some soreness, discomfort, but that usually dissipates pretty quickly. Very, very low risk for patients to just try PT first.
And I hate to say it just because I've gone through so many rounds. It's kind of, I'm guessing it's like women who have given birth several times. They're in this, yeah, do what you got to do kind of mode. Been there, done that. And for me, that's kind of how I got at some point, because the PTs, especially maybe some of the newer PTs, they might approach me a little more gingerly.
Yeah.
And I would just say, you know what, just like go for it.
Yeah.
Do what you got to do. But sometimes for me, I needed somebody who was a little more aggressive. And that's why I think being able to ask those questions or understanding a PT's approach, and again, vetting them out for who you think will be good for you,
hmm
is important.
You just have to feel comfortable with them too. You're going to be spending a fair amount of time talking about some pretty intimate details. So, worth it for you to just feel like you can talk to the person.
Well, half the time we end up talking about like recipes and favorite restaurants, because at some point you're doing your thing and it can't always be all business. Is it usually an hour, or how much time do you usually give in a session?
That absolutely depends on where I'm practicing. So, as a traveler, I've been able to practice in a lot of different settings and a lot of different clinics. The clinic setup really does dictate that. So, there's been a few clinics where they ask me, do you want to see patients for an hour? Do you want follow ups to be how long? But in most cases, it's dictated by how their clinic runs. I've had some clinics where we're seeing patients one on one for 60 to 40 minutes, and it's just you in a room and you have the utmost privacy and flexibility. I've had other clinics where sometimes I would be seeing two patients at once for pelvic floor disorders. And if I needed private time, we'd have to schedule separately so that we have that private time. But otherwise, we'd be in the gym doing exercises, doing cardio, doing more physical exercise than just the in the room types of treatments. But in my personal experience, I prefer to have the patients one on one as much as possible because I feel like so much of the nuances of what I'm teaching my patients requires that very close cueing and privacy. But I also understand that being in a gym around other people exercising has its own psychological benefits as well.
You mentioned that some physical therapists, or the physical therapists that are working with pelvic floor patients, have I think you called it a level 1 certification. Was that it?
Yes.
Yeah. So what is that? And then what's the really intense training like for a physical therapist who's treating patients for pelvic floor issues? Because, obviously you got your PhD, you started there. And then there's, other education or certification. So what's important for a patient to know about the qualifications of their pelvic floor PT?
Yeah. So, to start out as a physical therapist, generally it's 7 total years of training. So, you have your undergrad for 4 years, graduate school for about 2.5 to 3 years, and then you come out with a clinical doctorate. In those clinical doctorate classes, there's usually like a half of a day or one class where they talk about pelvic floor dysfunction just to create some basic understanding. So, most general PTs will be able to kind of problem solve their way through some pelvic stuff. if your symptoms are pretty low risk or easier. However, once people start going more for that special certifications in pelvic floor training, then there's a large breadth of different backgrounds and education to go into. So there are two main educational bodies providing physical therapy, pelvic floor physical therapy education. The first one is the APTA, American Physical Therapy Association, and then the other is Herman and Wallace. They kind of have their own setup. Each one's a little bit different with their own nuances, but they'll take you through, or they'll take the learner through learning the pelvic floor and the basics. Usually level 1 covers bladder dysfunction, and usually in female bodies, maybe a little bit of prolapse. And then as they progress through different levels, they'll meet those different patients and populations and treatments and modalities. What I like about the Herman and Wallace courses is they actually do allow more than just physical therapists to come to their courses. So sometimes I'm in there with acupuncturists, chiropractors, medical doctors, and then we're all able to kind of share our backgrounds and talk to each other about that. So I feel like you get a little bit more of that interdisciplinary learning from each other. Um, and then the WCS is the APTA's women's clinical specialist, and you have to sit for an exam every 10 years. You have to have passed all of the coursework, provided all of the fees. Herman and Wallace has the PRPC, or the pelvic rehabilitation. Similar, you have to have done at least 2,000 hours of working with patients and then sit for the exam. But in the Herman and Wallace instance, I like that they cover more all of the genders, whereas the APTA's WCS is very specific to education for women.
Okay.
Someday I hope to sit for the PRPC because I like the idea of working with all pelvic bodies, not just women's health.
Well, that's 2,000 hours. That's extensive training then.
It's patient hours, so documented patient hours that you've worked with people who have pelvic conditions. So it just shows that you've been putting into practice the things you're learning, and you're not just taking all of the courses to sit for the exam. They really do make sure that you are utilizing the information. I think in both instances, you have to write a case study as well, just to show, again, that you have that background.
And I understood from one of the PTs that I saw, I think over my time, I've gone to 7 different ones, honestly. But I think she said that you practice on each other. Is that right?
Yeah, in most of the courses, you are working hands-on with the other people who are taking the course. How else are you going to learn about those muscles than to have yourself palpated and to palpate other bodies, because no body is going to be the same. So the more repetition, the better learning, and the more you're prepared to actually treat a patient in front of you, and you're not surprised by anything.
I think that's so important. And of course, with physician specialties, of course, I mean, it would be nice for doctors to have empathy with all kinds of conditions, or maybe had some point of reference for a family member or themselves. But the point is that we don't always know what the patient is going through unless you've gone through it yourself, truly gone through it. And so good for you that you have made the commitment to this specialty of physical therapy. So I think that's amazing what all of you are doing. Alina, as we talk about patients who maybe didn't get the recommendation by their physician to get pelvic floor therapy, um, are there women experiencing these types of delays in getting therapy, or getting their doctors to refer them for pelvic floor therapy? What are some of the challenges from that standpoint?
On average, we've seen that women wait about 6 years before even seeking treatment for pelvic health issues when their symptoms arise. So whether that's choosing in-person therapy or telehealth therapy, like simple therapy that I work with, the goal is that the faster we can get people care, the better their chances are of improving their quality of life and preventing future complications. So, if you're even noticing the smallest symptoms, or you're feeling like, man, this could be a pelvic floor problem and maybe I should just have someone look at it and give me advice, then the sooner the better. We'd rather see you when the symptoms are very small and simple to address than when they become big and chronic, and it takes us a much longer time to provide that care.
And it sounds like that's where your checklist would come in handy. That's
Yes.
yes, very cool. What would the telehealth or teletherapy visit look like different from an in-person session?
Yeah, I'm actually very passionate about providing telehealth services because I find that access is such a big challenge for patients. So, when someone can, from the comfort of their own home, be talking about these concerns and be getting some guidance, it's a lot easier to dive into those conversations sometimes when you're in a comfortable space. You're not in a creepy little clinic.
Mm.
You have that ability to, if you need to look away from the camera to say something embarrassing, like you have that ability.
Yeah, yeah.
And we can reach broader a broader geographical space. We can see more patients in a wider area through telehealth. One of the limitations, very obviously, is doing virtual visits through Skype or similar things like this, like what we use in simple therapy, is that I can't put my hands
Mm.
on the patient, which is half of how I get my information when I'm face to face. So you have to be a little bit more creative about how can I assess this person's balance or their breathing technique or their posture by watching them on a screen and asking them to move in different ways, as opposed to in the clinic, I can just get my hands right on the patient. Obviously, we can't do an internal exam through telehealth either. But I've come up with a lot of little tips and tricks to help patients at home. Like I had written a whole script of how to do their own internal exam and how to palpate their own musculature and get a better understanding of their own structures and then talk to me about it. And then we can problem solve a little bit that way. You kind of have to be willing to do some different things with telehealth, but at least it gets you the care.
Mm-hmm. Yeah. Yeah. And I'm sure even in those rural areas where pelvic floor PTs may not be available at all, or they might not be available for an hour away at the medical center or whatever. So that's a fantastic service that Simple Therapy does offer. And tell us a little bit about the company and how it operates, how you work with them, and what they can provide.
Yeah, so Simple Therapy is a digital solution to therapy provided by someone's employer as part of their benefit package or their healthcare plan. So we don't have direct access to Simple Therapy at this time for the average person, but if it's in your benefits package from your employer or as part of your health plan, then you have access to it. The only exception to that is the positive health, which I think we can talk about in a moment.
Mhm.
But it's a great way for us to get the ball rolling. If wait times are long to get into a pelvic floor PT, then sometimes having them meet with me digitally, getting them started with those simple exercises on Simple Therapy's platform. If wait times to get to the face to face appointments are too long, learning those basics. Or if you're interested in maintaining the gains that you've already made from face to face therapy and you want to keep that going but need someone to hold you accountable, Simple Therapy can do that and kind of help them continue on that track.
Mhm. You mentioned direct access, and if I understand right, there was a time where you actually needed a physician order, but there are instances now where if you just wanted to go have physical therapy, you wouldn't need an order. I don't necessarily know how that works with insurance then, but is that what direct access is about, or are there some other nuances to that?
Yes. So direct access in general is just the ability for you to see a PT before having to be screened by a medical provider. which is why it's important for our physical therapist now to have such a robust educational background, because we have to do some of that medical screening. Whereas before, the doctors were doing it and the patients coming to us were definitely screened, and we know that all the red flags are not there and they're healthy and they're ready to begin exercise. Whereas now we have to do that more. But I think that that's a great chance for patients to be seen faster than to have to wait for their specialist or wait for their primary care provider and the appointment. And then that doctor's not really going to do a deep, in-depth assessment like what physical therapy is going to do. So it really just delays their care.
So that was a great thing for physical therapy and for patients, of course, too, to not have to go through the middleman of their doctor. In this case, they would be the middleman. And then as far as insurance would go for direct access, then it would be the clinic that would have to do any pre-certification or anything that would be required through insurance. Is that right?
Yes, and I believe there are still some instances where patients still need that referral from the doctor. I believe Medicare might be one of them. But in cases where you have more of a private insurance, you might have the ability to see a PT first. So I know Wisconsin is definitely a direct access state, and I think it also varies. Other states might not be.
You were starting to talk about positive health, which is how we were connected because I've had Dr. Colette Edwards on my show twice now. First time with her co author of her book, Navigating Your Healthcare Journey, Getting the Care You Need and Deserve. And then she came back on the show. We talked all things menopause. Yay. At least we're talking about it. And there's so many more conversations going on social media and on TV and whatnot. I realized just like a week ago or so that it's Pelvic Health Awareness Month. And so I emailed Colette and I said, hey, do you know a physical therapist who treats pelvic floor who has an amazing personality? And boy, did she deliver, Alina.
Thanks, appreciate it.
She delivered for sure. So yeah, we can definitely talk a little bit about what positive health is all about, and it's such an amazing resource for women in menopause.
Yeah. So positive health, for those of who haven't maybe listened to those episodes, is an amazing resource. It's spelled PAUSITIVE health, and it offers support tailored to this stage of your life. There's access to so many different medical programs, but Simple Therapy did provide the exercise modalities and the exercise treatments in those. So if they don't have access to Simple Therapy in their health plan, Positive Health and that initiative could be a way for them to access Simple Therapy and see what we're all about.
I had signed up for it last year, and I get all these little text messages reminding me about things like sleep and did you move? What are you eating? And this is good for that, and that's good for this. So it's great to get those every few day reminders about, oh yeah, I should think about that, or I might want to consider magnesium to help me sleep or whatever it might be. So those little reminders I think have been really helpful, but the site itself is just so rich and robust with information. And yes, I would encourage everyone to go to positivehealth.com and get registered and signed up, since it is free at the moment, end of June 30th.
30th.
Okay. I did not know that. That's really good to know. I'm going to make sure I put that in the show notes as well. Well, this has been so cool, Alina. Anything else that we missed?
I think my final takeaways for your listeners, thinking about pelvic health in general, is it's not just about Kegels. It's more about awareness of those muscles. So even just tuning into what those where those muscles are, feeling them when you're breathing, knowing how to contract and relax them, those are the first steps. So that, and then generally healthy habits. We've even seen in research that 20 to 30 minutes of a zone 2 cardio program, at least a little bit every day, can help bring blood flow into that area and help with pain conditions, urinary conditions. constipation. So in general, just those healthy habits, get moving, get out of the house, do something for 20 to 30 minutes, and you're already going to be doing good things for your pelvis.
What's a zone 2 activity?
Zone 2 activity is where you're aiming for a 60 to 70% of your max heart rate. So there are some little online calculators that you can use, and you can type in your age and then the zone that you're looking for, and it will tell you what heart rate to aim for. But in general, you just want to be a little short of breath. And if someone's talking to you, you can have a conversation. So it's that nice, comfortable, I'm doing something, but I'm not pushing myself so that I can't breathe or can't hold a conversation. That's a
Mhm.
good way to think about it.
Yeah, no, that's great. I know I always felt better as I was moving because even now, so many of us are still sitting for our jobs or just with the dang screen all day long. That for me, when I was really in some bad pelvic floor flares, like just to get up and moving and actually stretch out those muscles and ligaments and tendons and all of that to get things kind of woken up because you don't realize when you're sitting and muscles get stiff and all of that. I always felt better when I would move, and my hobby is ballroom dance. So when I was having flares, I would go dance, and of course, just the endorphins from dancing
Yes.
were helpful. But to be moving always made me feel better. Now I couldn't go out and do ab workouts with my level of tone in my muscles and having really spastic muscles. So I couldn't go out and do that. I can do it now because things have changed, which is good, and PT helped that. But it's always helpful to get up and move. I once had a doctor, I sprained my ankle. So I was asking you about the what part of the ankle you put that TENS unit, and you pointed to the inside ankle, and I had sprained my ankle so badly 3 years ago that I sprained the deltoid ligament. What was I doing, you ask? I was
Yeah.
just walking downstairs in my house in running shoes, but I wasn't running. But the point is that that doctor told me, because I started walking after a couple weeks because I felt better, not great, but he said, You're doing too much. Don't walk. You need to stay off of it." And the PT that I went to, he said, that is the worst advice that he could have given you. If you felt that you could walk, you know when you couldn't do it any longer, that was terrible advice. So yes, keep moving is good advice for any purposes, but definitely for pelvic floor health. That's fantastic. Those are fantastic recommendations, Alina. Thank you so much.
Yeah, my pleasure.
Yeah. Well, everyone, so great to bring to you some amazing information about pelvic floor therapy. I hope that has taken some of the mystery out for some of you, and definitely talk with your doctor if you are suffering from any of these symptoms that we've talked about. And we will put everything in the show notes that we talked about today and some links with more information and the checklist and more information about positive health. We're just going to give you all kinds of stuff to get you armed and ready to feel better. So, Alina, thank you for being with us today and for all of your wisdom. And everyone, stay well and keep pushing for answers. Oh my goodness, that's a wrap on another compelling story. Thanks for listening to the Desperate for a Diagnosis podcast. If you would like more information about today's guests or to find out more about Laura, go to desperateforadiagnosis.com. If you enjoyed the show, please subscribe, rate, and review the podcast on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. You can also follow show updates and healthcare news on the podcast's Facebook page. If you would like to be a guest on the show, or if you have any questions, advice, or suggestions for our guests, please email me at lauramarie@desperateforadiagnosis.com. Please note, I am not a medical professional, nor am I affiliated with any healthcare, pharmaceutical, or device company. I am an independent market researcher focused on helping healthcare organizations better understand the patient perspective. The podcast is not meant to offer medical advice, but to merely share the stories and perspectives of podcast guests.